Welcome. We're about to dive into some really groundbreaking research that could honestly change how doctors look at MRI scans for chronic pain. It all comes down to one critical question. Could the very pills you take for relief actually be hiding the truth about your condition from your doctor? Yeah, think about that for a second. It's a pretty wild idea, isn't it? You're taking something to feel better, to manage your pain, but that exact same medication might be covering up the clues your doctor needs to diagnose you correctly. It's a real puzzle, and today we're going to put the pieces together. Okay, so to really get why this research is such a big deal, we first have to talk about the diagnostic dilemma that's been going on for years. This is a huge challenge that patients and doctors face all the time when they're trying to figure out what's really happening inside the body. Now, the condition at the very center of this story is called axial spondyloarthritis, or AXSBA for short. If you've never heard of it, it's a type of inflammatory arthritis that mainly goes after the joints in your spine and pelvis. And trust me, this isn't your average backache. It's a serious, chronic condition that causes a ton of pain and can really get in the way of your daily life. So how does a doctor even figure out if you have this? Well, they've got a toolkit. They'll listen to your symptoms, run some blood tests to look for inflammation, maybe do an X-ray to check for any long-term damage. But the real game changer, the tool that lets them see what's happening right now, is the MRI. The MRI is the only thing that can really see the active inflammation, this swelling deep inside the bone that doctors call bone marrow edema. And here's where the plot thickens. The number one treatment for AXSP is usually a non-steroidal anti-inflammatory drug, an NSAID. You know these. We're talking about ibuprofen, naproxen, things like that. Their whole job is to reduce inflammation. But wait a minute. The medicine is designed to stop the inflammation, and the MRI is designed to find the inflammation. You see the problem here? It's like trying to find a fire with a thermal camera right after someone's used a fire extinguisher on it. You might not see anything. And get this. This wasn't just some theory people were kicking around. For years, there has been absolutely no official guidance on this. None. Doctors and patients were just left guessing, having to make this really important decision completely in the dark. Do you suffer through the pain and stop your meds, hoping for a clear scan? Or do you keep taking them and risk the scan not showing anything? So, this is where the science comes in. A team of researchers decided it was time to stop guessing. They set up a study to get a real, definitive answer. Is this conflict real? And if it is, how much does it actually matter? This was their formal hypothesis. In plain English, they were basically saying, we bet these common painkillers are hiding the signs of the disease on these super sensitive MRI scans. Their mission was to prove it. The experiment they designed was called the DyNAMISM Study, and the design itself was incredibly smart because it allowed them to see the direct effect of the medication on the MRI results with no guesswork involved. Here's the four-step plan, and it's brilliant. First, they had over 300 patients stop taking their NSAIDs for a week or two. That's called a washout. Then they did an MRI scan to get a baseline to see what the inflammation looked like with no medicine in their system. Step 3. If that first scan showed inflammation, they had the patients go back on their meds for 6 weeks. And finally, they did a second scan. By comparing the off-med scan to the on-med scan in the very same person, they could perfectly see the drug's true impact. All right, this is the moment of truth. After all that work, what did they actually find? What did the doctors see when they put those two sets of scans side by side? The results were, well, they were stunning. For 20.2% of the patients, that is 1 in every 5 people, the inflammation that was clearly visible on the first scan had completely disappeared on the second one, gone. According to the MRI, the disease was no longer active, just because they started taking their daily painkiller again. But it gets even crazier. More than 40% of all the patients showed a significant drop in how severe their inflammation looked. So even if it didn't vanish entirely, the signs were way less obvious. It wasn't just an on-off switch. It was like a dimmer switch, making the evidence of the disease much, much harder to spot. And they didn't just rely on what the radiologists saw. They used advanced imaging to get cold, hard data. Now, these charts might look a little intimidating, but they're actually simple. They're called violin plots. The white plots show the scans without any NSAIDs. The red plots show the scans with the NSAIDs. See how the red plots are clearly shifted higher? That's the data showing a measurable, consistent drop in inflammation. It's the objective proof. Okay, so the evidence is undeniable. But what do we do with this information? What does this mean for real people, for patients and doctors out there right now? This is probably the first question that popped into your head, right? It's one thing to talk about this in a study, but it's another thing entirely to ask someone who lives with chronic pain to just stop taking their pain medicine. That's a huge ask. And the researchers knew they had to answer this question. The data they found was incredibly reassuring. The vast majority of people, over 90%, were able to get through that 1 to 2 week washout period without any major issues. Sure, a lot of them said their symptoms got a bit worse, but the increase in pain was mostly modest. And here's the kicker. Only a tiny 2% had a flare-up that was considered a real problem. So the evidence is pretty clear. For most people, taking a short break is totally manageable. So the final verdict from this landmark study is as clear as day. Taking a short temporary break from NSAIDs before you go in for an MRI isn't just a random idea. It can give your doctor a much more accurate picture of what's really going on. It can literally unmask the disease. And that brings us to the final powerful takeaway from the researchers themselves. They are calling for this evidence to be written into new medical guidelines. The goal is that in the future, if you're willing to try stopping your meds for a short time before a scan, your doctor should encourage and support you in doing that. It really makes you wonder, doesn't it, what other common medications might be quietly changing the results of our most important tests?